Hello everyone, my name is Natasha and I am the Clinical Director at Alpha Healing Center. Let's talk about what the family should know about addiction. Here are some points that would help you know about addiction. The first is, you are not to be blamed for the addict's disease. You did not cause it, you cannot control it, and you cannot cure it. The second thing we'd like you to know is, you are responsible for your own behavior. You have a choice to refrain from enabling the addict's drug use and drug-related behavior. Most often, families enable the addict's behavior by covering up for their behavior, by repaying their debts, by lying for them, by hiding things for them, and maintaining secrets for them. The third point is that the addict has a disease and it is not a sign of family weakness or disgrace. Next, nagging, preaching, moralizing, threatening, or blaming the addict for past and present mistakes will not change his or her behavior. The next point, which is also very important, is do not cover up, make excuses, or otherwise try to protect the addict from the natural consequences of his or her behavior. Addicts are most likely to seek help when the pain of using their drug becomes worse to bear rather than the pain of not using it. Do not play shrink or make psychological excuses for the addict's behavior. The addiction should not be blamed on childhood traumas, job stress, or marital problems that must be resolved before the addict can stop using. It just further justifies the addict's drug use. So the family has their own set of maladaptive responses, and some of these maladaptive responses are where the family tries to minimize the problem, they try to eliminate the consequences for the addict, they try all control measures but they fail, and they also attempt to reorganize the problem for the addict in spite of all the problems. And lastly, they also put in a lot of efforts to help the addict escape the problem. The next point that we'd also like you to know is, do not search for, hide or throw away the addict's drugs, paraphernalia. The addict will just get more. There is no way to keep him or her away from drug using friends either. The next point is, laying guilt trips on the addict does not work. Saying things like, if you really loved me, you would stop doing this to yourself, only creates negative feelings that give addicts more of an excuse to use. Next point is, you can and should set limits, but don't use them as a means of manipulation. Be fully prepared to follow through on anything you say, otherwise the addict will further discount you. The next thing you should also remember is, do not accept the addict's promises to be good without any follow-up. Stick with what the addict does, not what he or she says. Do not allow the addicts to exploit you momentarily or in any other way. Always maintain your dignity and self-respect. We also want you to know that to not ignore or overlook lying and any forms of deceitful and manipulative behavior. Do not collude with the addict in keeping drug use a secret from the therapist or the program or the doctor. To do so only perpetuates the problem and assists the addict in evasion of responsibility for his or her behavior. So overall, what can the family do? The family can seek help for themselves to address some of the following points. How to deal with the addict's behavior, how to learn to focus on their own personal needs and personal growth, learning to choose appropriate behavior for themselves, learning to be in control of one's life, and help can be in the form of therapy or joining a support group. Thank you.